Assalamualaikum. It's me Nimra Shahzad. My roll number is BP165069 and I am here to present my topic that is on the drug ethinyl estradiol with Norethesterone. First of all, we will be discussing the indication and the rational use of this drug, that for which purpose we are basically using this drug. Basically, this drug is a combination of two hormones, that is estrogen and the progesterone, which is used to prevent pregnancy. These are also called as birth control pills. It is the most common type of oral contraceptive method. These preparations are highly effective in achieving contraception. Basically, by using this drug, we are preventing pregnancy. Now, the mechanism of action of this drug. As we know, this drug is a combination of two hormones, estrogen and the progesterone. So each hormone will individually show its effect or its mechanism of action and helping in contraception. In this combination, estrogen provides negative feedback on the release of LH, which is luteinizing hormone, and FSH, which is follicle stimulating hormone, by the pituitary gland, thus preventing the release of an egg during menstrual cycle, which is the process of ovulation. Now the progesterone, it shows its effect by thickening the cervical mucus, thus hampering the transport of sperm. The withdrawal of the progesterone stimulates menstrual bleeding during the placebo week. It also changes the lining of the uterus to prevent attachment of a fertilized egg, hence preventing pregnancy following oral contraception. Now the side effects of this drug. There can be different side effects of this drug depending upon the lady which is taking this contraception pills, and the incidence of the side effects with the oral contraceptives is determined by specific compounds and the combination used. Means, as we know, this drug is a combination of two hormones, so each hormone will show different types of side effects depending upon the lady, but both of these hormones will perform its function, so or both of these show different types of side effects. According to this combination, we will have side effects like because of the estrogen we can have the side effects like breast tenderness, fluid retention, headache, nausea, increased blood pressure and swelling. And because of the progesterone, it may associated with depression, changes in the libido, hirsutism and acne. The another side effects can be incidence of cervical cancer, may also be increased with oral contraceptives because women are less likely to use additional barrier methods for contraception. The another side effects can be abnormal or unusual vaginal bleeding. Now the dose variation and the adjustments for this contraception pills. In the adults and the teenager, 1 tablet daily containing drug for consecutive 21 days, followed by 1 week without drug, means in this there is no drug, and these are called as placebo tablets because they are basically the iron tablets. In the pediatric, this medication may be used for birth control in teenage patients, in teenage females, but should not be used before the start of menstruation. This drug is basically contraindicated in the children, in the pediatric before menstruation, and also in the women after the post menopausal time. Now drug interaction means this drug can be interact with different types of drug if the person is taking before because of any reason. So we have different types of examples, like first we have rifampicin, and if we are using this contraceptive therapy with rifampicin, then it can increase estrogen metabolism, which will cause reduction in oral contraceptive efficacy. Means by using a drug with rifampicin can lead to decrease contraceptive efficacy and there will be no contraception. It will lead to pregnancy. The another example can be ampicillin, which lead to interruption of interohepatic circulation of estrogen, causes reduction of oral contraceptive efficacy. And then some other antibiotics may also have similar effect, leading to pregnancy and there will be no contraception. Some other products may interact with this drug includes aromatase inhibitors such as estradiol, exemestane, phenytoin can also be used. If used, then this can occur all, or corticosteroids, etc. Now the contraindication of the drug. Oral contraceptives are contraindicated basically in the presence of cerebrovascular and thromboembolic disorders. and estrogen dependent neoplasm, liver diseases, and pregnancy. Now, the combination oral contraceptives should not be used in the patients over the age of 35 who are heavy smokers. This drug is also contraindicated for the patients of hypertension and hypertriglycemia. In all these conditions, this drug should not be used. Now, the drug toxicity means by using this drug, we can have different types of toxicity in our body. So, what are these toxicities? These are evidence for carcinogenicity, means there can be chance of cancerous formation, the cancer like uterus cancer, ovarian cancer in the female. So, there is sufficient evidence in human for the carcinogenicity of post-menopausal estrogen therapy. The second drug toxicity can be concurrent use of calcium supplement with estrogen may increase calcium absorption. Means by using this drug, there can be calcium absorption in our body, and if there will be calcium absorption, then there will be thromboembolic disorders, thrombus will be formed, emboli will be formed. Then if these conditions occur, then there can be myocardial infarction. As we know, we can have this condition, and because of calcium absorption, there can also be the kidney stone formation in our body, and there can be exacerbate nephrolithiasis in susceptible individuals. The other toxicity is that female patients experiencing and overdose may present with withdrawal, bleeding, nausea, vomiting, breast tenderness, abdominal pain, drowsiness, and fatigue. These all can be drug toxicity by using this contraception pills. Now the dosage form. This dosage form is available in usually 2 phases. Means we can have 2 phases of this drug. The first is monophasic. In the monophasic, it contains a constant dose of estrogen and the progesterone given over 21 to 24 days. The other phase can be triphasic. Triphasic oral contraceptives products attempts to mimic the natural female cycle and most contain a constant dose of estrogen with increasing dosing of progesterone given over 3 successive 7 days period. Now the availability of these dosage form. The product of the contraception can be available in different following dosage forms like tablet, chewable dosage form, and the capsule liquid form. Now the availability of different types of brands. There can be many more brands, but here we are discussing only 3 types of the brands. The first brand is Geogynon, and there are different types of manufacturer for each brand. Like Geogynon is manufactured in the German pharma, and the second is Gyneric, which is manufactured in the Zephyr Pharmatic, and the third is Hydrate N, which is manufactured in the Hygia, which have different trade price. Each and every brand has different trade price for in our country and in different countries. Now for the contraception, we are discussing a case study for our understanding, and the case study which I have chosen is a patient is 19-year-old mother of 2, the younger of which is 9 months old, and her last pregnancy was a difficult one, and she doesn't want another child for several years. She came to the clinic for the contraception therapy. The woman is obese and diabetic patient, for which she uses metformin before meal. Now, which contraception therapy would you recommend? So, for this case study, we have a SOAP note. In the SOAP note, we have first subject. In the subject, the gender is female, whose age is 19 years old. She visited hospital for the contraception therapy, as she is the mother of 2 and obviously doesn't want another child now, as her younger one is 9 months old, so she doesn't want any pregnancy. And in the history, her medical condition is obese and diabetic patient, and for the diabetes she uses metformin, which is so the diabetes is controlled by the metformin and her diet. The assessment of our SOAP note. In the assessment, first before giving the therapy, the pelvic ultrasound should be performed, for if there is any complication, so we can know before the giving the contraception. Otherwise there will be further complication if we doesn't do the ultrasound of the female. So we should perform the pelvic ultrasound if there will be any problem in the patient's, in the lady's body, in the lady body. So we can have further conditions like and also we should perform different types of testing like blood test. So if there will be complication, we will know about that. Then medication should be prescribed for contraception. Now in the plan, according to the case, the patient wants contraception. So for the contraception of the drug of the lady, the drug is which is recommended is, we have different types of the drug, but here we are using Gynorate. As the dose of the Gynorate is that it will contain 28 tablets, in which 21 tablets are active pills with medication, in which the medication is present, and 7 reminder pills with no medication. And the 7 reminder pills will be used during the menstrual cycle. Now this medication should be used after your evening meal or at bedtime. It is very important that you take this medication at the same time each day, 24 hours apart. Means each medication will be used after every 24 hours at the same time daily. If we do not have Gynorate, then the Norcept can also be used for this condition. Now something we should be considered by during using this contraception, that the medication should not be skipped for a day, otherwise there can be chance of pregnancy, so inhibiting the contraception. And the other thing is that the lady should be use different supplements like iron supplements, multivitamins, and should assure the healthy diet, good sleep, and avoid stress. Then the contraception therapy will be perfect for a lady or will work for a lady. Thank you.